Mrs. H is a 96-year-old female who presents to PT after falling down her back steps and being unable to get off of the ground. In our PT session today, we're going to focus on floor to stand transfers due to the fact that she was unable to get off the ground. She exhibits lower extremity weakness and difficulty kneeling and bending. So since she's at a higher risk for falls, we want to make sure that she's comfortable and how to get up off the ground if she were to fall again. So our mode of exercise today is a floor to stand transfer. Our intensity will start off in quadruped, and we'll go through a rep of that. If that were too difficult, we would regress to having her start in half kneel position. If that were too easy, we would move her down to prone to getting up to the standing position. We would want to monitor her for loss of balance, any disorientation, and we would want to monitor vitals with the changes in position as well as rate of perceived exertion. Overall, our short-term goal for Mrs. H is that the patient will perform a floor-to-stand transfer with minimal assistance successfully in 3 out of 3 trials in 2 weeks.
Hi, Mrs. H. My name's Lauren. I'll be your PT today. Is it okay if we work together?
Yes.
Okay, cool. So for this video, we're gonna pretend like this table right here is the wall. And then before I start any of this, I would take the patient's vitals and just ask at that point what their RPE would be on a scale of 1 to 10. Okay, so we're gonna start by getting off the floor. I'll be here to help you through all of it. We'll start by hands and knees on the floor, okay? So you're gonna come down just like this. I'll help you get down, don't worry. Hands and knees looks like this position. And if you can, tuck your toes underneath. We'll try to do that here. And then we're gonna end up using the chair to stand back up. Okay, I'll be there with you the whole time. You let me know if that is uncomfortable for your wrists. If it is, we'll just start from right here. Okay. Okay, so come on up to the chair. I'm gonna be right here to help you. I want you to start bending your knees and reach your hands down and grab the chair. Good. And then start bending at your knees. We're gonna take your knees down to the floor. Step 1 foot back. Bring this leg back. Good, good. And you can bring the other one down. Good job, good job. And then bring your hands down to the floor. I got you, you're not gonna fall. Great. Good, how do you feel? Okay, feels okay. Okay, so now we're gonna bring your right leg up. We're gonna step it right next to your hand. Okay, I'm gonna help you by grabbing your leg back here. Is it okay if I touch you?
Yes.
Okay, awesome. We'll go on 3, ready? 1, 2, 3. Good, I'm gonna reposition it for you just a little bit, okay? Good, feeling good?
Yes.
Cool, bring your hands up onto the chair. Got you. Okay, we're gonna work on pressing hard through this front leg. We're gonna shift onto it, and we're gonna stand up. I'll be here to help you at your hips, okay? On 3. 1, 2, 3. Good, bring that leg up. Okay, bring your hands onto your thighs. Got it, one and the other. Good, and then walk your hands up your legs. Go ahead and stand up tall for me. How do you feel?
Okay.
Good, on a scale of 1 to 10, how tired are you feeling?
Just like a 2 or 3.
Good. And then I would take her vitals again here too. Okay, Mrs. H, since that was really easy for you last time, getting up from your hands and knees, we're gonna make it a little bit harder. I'm gonna have you get all the way down onto your stomach on the floor, and then we'll go from there and get all the way back up. We're gonna pass through that hands and knees position. Okay, sound good?
Yeah.
So come on up towards your chair. We'll get down on the ground the same way we did last time. So start bending at your hips, reach down for your chair. Good, keep bending at your knees. Let's see if we can go down, step your left foot back. Good, and right foot back. Good, and then bring your hands down to the floor. Good, I'm gonna help you pull your knees back a little bit, okay, so we have some room. You're gonna crawl back, bring your hands back towards me. Good, let's do 2 more. Back it up. Good. All right, whenever you're ready, start bending at your elbows. You're gonna come down onto your stomach. Good. How do you feel? Good. Good. Okay, we're gonna practice from here, getting up onto your hands and knees. Okay, so I want you to bring your hands underneath your shoulders. So pull them back just a little bit. Good. I want you to roll onto your side just a little, pushing into this hand, bend this knee up. Good. And start pushing yourself up onto that knee. Good. And then bending in at this hip. Bring this leg forward. Good. Remember, this is where we were last time, okay? So take a little crawl forward if you can. Move your legs so you can reach your chair. Okay, we'll practice with this right leg coming forward again, okay? On 3, we'll go and I'll help you. Ready? 1, 2, 3. Good. Let's reposition. Bring it just a little bit closer to you. A little bit more. Good. And then we'll shift and we'll go up on 3, okay? Bring your hands up onto your chair. I'll be here to help you. All right. 1, 2, 3. Good. Nice. Bring your hands onto your legs. Let's walk it up. Big deep breath. Come on up. Good. How do you feel?
It's a little hard.
How about out of 10?
Like a 6.
Like a 6? Good. I'm going to take vitals again here too. Hi, Mrs. H. Today we're going to work on getting you up from the ground again. This time, because last one was a little bit challenging, just getting up from the ground, coming from your knees. Okay? So you're going to start at your chair and you'll be just right here.
I just thought that I needed
Okay?
to hold this.
Then we'll work on getting your legs up and then back up to standing. I'll be here for the whole thing. Okay? So come on up towards your chair. Good. Start bending forward, your hips and your knees. Onto your chair. Good. And then we're going to bend your knees even more, as much as you can, and step whatever foot you want back behind you. Good. Lower down onto that knee. I got you. Good. And then bring the other one back. Nice. Feel okay?
Yeah.
Okay. We're going to come up from here. We'll use your right leg. I'll help you. We're going to shift back into the left. And on the count of 3, we'll step up. Okay? 1, 2, 3. Nice. Okay. You're going to use your hands. You're going to push as hard as you can into this leg. And I'm going to help you. We'll stand up on 3. Okay? 1, 2, 3. Good. Bring your hands onto your legs. And then let's go ahead and stand it all the way up. How do you feel? Good. 1 to 10?
It's like a 2 or 3.
Great. And then I would take her vitals here too.
All right, so because Mrs. H does have some sort of cognitive impairment, this treatment session would depend kind of on a case-by-case basis, depending on what she felt like she could do that day and how the treatment session go. For the purpose of this video showing our intervention, we decided to show how we would start it and how we might progress or regress depending on the day and the treatment session and how we feel like she's progressing along. With that being said, our goal is to work our at least 15 minutes on this floor to stand transfer, and we'd want to make sure that we got in at least 1 good rep with her during this treatment each time.